In Manchester, our health is worse than the national average. More of our children live in poverty.
There is more obesity, more alcohol-related hospital stays and more smoking-related deaths.
Our average life expectancy is shorter.
Loretto College has been working with the Manchester Academic Health Science Centre, a group of hospitals and the University of Manchester, to create a short play exploring the health challenges that face our communities.
Today we're performing our play at a conference for 70 young people from schools across Manchester, who have been invited to advise MAHSC on how we can face these challenges. I've been through several changes in the NHS.
I know it's not good, but it's either that or hit the drink.
I've still got time to get there if I don't do anything.
You don't need a doctor, I look after you.
This is the first time the Academic Health Centre has engaged children. We're really interested in what their views and opinions are because we're determined to improve health in Manchester. We hope what today will do, it will bring new ways of engaging children with our scientists. And by engaging them, it will do a number of things. The first, they will learn about health and health prevention, but also it will give them an appetite to enter into science for the future. And by becoming scientists and by entering the health professions, they can make an impact themselves.
We worked with psychologists who try to understand how we make decisions about our health. We explored different ways of encouraging people to live healthy lives and looked at statistics to understand the risks reported in the news.
You're walking home from school, you go to a takeaway because it's right there, but you never stop to consider what it can actually do to your body. So the problem for young people today is we're too ignorant, and we should now consider to try and benefit from healthier lifestyles.
In the afternoon, we worked in teams of teachers and researchers to advise MAHSC how they could spend £10 million to change behaviours and improve the health of our communities.
We came up with an idea that if we get the youth of our generation to start working on healthy living, then when they grow up they'll hopefully incorporate that in their families and their children so that they can grow up to do the same thing as well, and then we won't have to worry about future generations going through the same things that we're going through right now.
What we want to enforce is we think domestic violence isn't a thing that's as noticed as other things, and people can be afraid to speak up, so we want to create like hotlines for people to speak to maybe people that have been in that situation before and what they think they could do about it.
My group mainly focused on drinking and smoking habits. And one of the main ideas we had is going to like little children and talking to them and making like performances in their primary schools.
Well, we're doing adolescents from the age of 9 to 18 because they're the future generation of our country. And when they're the leaders, they need to know what's going on, don't they? Because if they don't know what's going on, then it'll be messed.
What I was asked to do, having done jobs essentially with government and being a doctor for most of my life, I was asked to go where no one else will, to say what's unacceptable, and to show how we can correct that without fear or favour. The north of England has reduced life expectancy compared to the south, reduced disability-free life expectancy, which means that a girl born in Manchester today, in East Manchester, will have 15 years fewer good health than a girl born in Richmond in London. That is wrong. That is socially unjust. And it's something we can do as a group something about.
It's very easy as a young person to think that things just are the way they are, that there's nothing we can do about it. For all of us, today has been the beginning of a journey of understanding, that if we work together, we can affect change.
Behavioural and lifestyle factors are major contributors in around 50% of all premature deaths. As well as trying to cure the consequences of ill health, we need to address the causes.
A healthy life is a journey, not a destination.
It's hard when there are things holding you back.
When you feel like you're on your own.
When there's so much stacked against you.
We need to ensure that everyone
has the freedom to live a life they value.